All right, everyone. Hello, welcome to another volunteer training. I appreciate you guys being here today. We're going to be joined by Marina and Stephanie, and they're going to talk to us about the programs and the resources that they offer. This is being recorded, so if you're watching this after the fact, make sure that you upload this into Optima. If you're on this call right now, I will be putting this in Optima for you, so you don't need to worry about that. Without further ado, I will let you guys take it away.
Alrighty. Do you want me to go first, Steph? Yes, okay. Sorry. I read your lips. Okay, yeah. Hi, everybody. My name is Marina Reynolds. I'm with Community Action. I'm here with Stephanie. And is Melinda on the call too? Okay.
No, she didn't get the invite either. She's coming over here. She's in
okay, great. We'll let her talk too. So we're all with Community Action. We work with different programs. I'm specifically with the Community Services Block Grant. For short, we call that the CSBG program. So what that program is it's designed to reduce poverty, revitalize low-income communities, and empower low-income families to become self-sufficient. So what we do is we help qualifying families meet their basic needs to ensure that they're able to focus on achieving educational and employment goals for them. Typically, once a family completes an assessment with us, we establish some goals with them, and then the case managers for the different counties will link families to childcare, healthcare, education and employment opportunities through direct service assistance or referrals to some of our other programs or some other grant funded agencies. So the qualifications for our program are income-based. We also screen for individuals who are either seeking or starting a new employment opportunity, and for those who are finishing school in order to seek employment. So really what our end goal is for families to reach self-sufficiency so that they don't need our services anymore.
And what kind of services do you provide? Like, is it monetary subsidies, or how does that?
We have different things that we can do. We do have limitations because we're not a very big program, so we don't get typically a lot of funding. But in the past, we have paid full and partial rent payments. We do need a lease agreement for those kinds of things. It can be rent to own as long as we have a lease. We've also done some utility payments. We do try to get them with our CAP program, but if they live, I know in Clayburgh County has their own CAP program, and it takes a while to get into that one because they are a little bit more limited. We've helped a lot with, especially with nurses, we've bought a lot of scrubs. We've also paid for their NCLEX exams so they can get their certification. We've paid for people to take the CDL exam. We've also paid for like steel-toed boots, employment equipment, or uniforms that they would need. It really just depends on the situation and like how much everything is going to be and how much we're given per county.
What service area do you cover?
So myself, I cover Brooks, Kennedy, and Clayburgh County, but we do cover, let me see, San Patricio, Duval, Jim Wells, B County, and the three that I mentioned.
So if we have a parent that could utilize services, is there like a referral program, or how do we go about letting potential clients know about your services? Where do they go to access them?
So they can either give us a call to our office. I'm located in Alice, but I do spend one day out of the week in Kingsville. But most of our stuff is just done digitally. They can text us pictures of the application that we send them. Or if you want to just give us their information, we can get in contact with them. We just ask that, you inform them that they're probably going to get a call from us, because we don't like to surprise people when we give them a call. We like them to know that they were referred. But yeah, we're really open to just working with anybody to get people into our program. If they want to contact us, or if they're not comfortable contacting us, if they feel like they're not going to get a hold of us, you guys can get in touch with us for them. However works best, as long as we can get all the documentation we need. Our application isn't very long, but we do require some extra documentation, just like a copy of their ID, just to prove that they're the person that they say they are, and information about the household, people that live in the home, leasing information if they are interested in us getting some rental assistance. And sometimes we can't pay everything. We try to work with other agencies to get as much as we can taken care of for them.
Do you guys provide any type of food voucher or like maybe HEB gift cards if they're in need
We
of?
have done food cards before. I know other programs have, I think Stephanie's program might have food cards for, is it McDonald's and Whataburger?
Yes, our program has gift cards for Whataburger and McDonald's, and depending on the family situation, if they do not receive SNAP benefits, we can actually go grocery shopping for them. There's certain items that we can purchase. I have a list of it, but of course, it's going to depend if they qualify for our program.
What is the income threshold to volunteer for your services, Marina?
So right now, our threshold, we're at 125% of the poverty level, but let me give you a number for that. So for one person in the household is 16,988. And for each additional person, it goes up $5,900 from that. So 2 people would be 22,000.
What happens if our parents, we service families that are involved in the child welfare system. So if we have a mother whose children are in the custody of child welfare services, do they still count those children towards their income level, or would that not be appropriate? How would that work?
So they wouldn't be living with the parent at the time?
Right, they'd be.
So they wouldn't be counted on the application.
Okay.
In that case, they have to be living in the household. That has to be where they're physically at. And it can change later, they can come back, but we would go off of what was originally on the application.
Got it. Anyone else have questions?
You're doing a real good job, Nicole, because some of the questions I was going to ask, you were asking.
I have a question in the chat. It says, do you all provide any type of parenting skills, money management classes, or nutritional classes?
We are starting, or we're trying to start a financial literacy, not necessarily a course, but like they call and we sit down with them kind of thing to get them more familiar with how to budget. We just went through a program through the Catholic Charities of Corpus Christi. It was very informative, and I didn't know that I probably needed to have a budget myself. So I might be taking that on myself and trying to get a hold of some of the clients that we have just to see how it goes. But that's really what we have for financial literacy. Parenting classes, our program doesn't, but we try to get people in touch with some of our Head Start support systems with CACOST, because they know more of that area, and they're more familiar with some of the support systems for that particularly. And we don't have nutrition through our program, but I can see if one of our other partnerships has something to do with that. I know that we don't particularly.
I have another question that says, what about transportation vouchers for parents who need to get visits that are out of town?
We've done gas cards before, but I haven't worked with getting actual transportation. But I do know that we were going to make a partnership with the DL bus transport. We just haven't finalized anything. We were going to meet with them sometime, what week are we? Maybe mid-July, and try and finalize something. I'm so lost with my days.
Me too. And what was that transportation place again?
Oh, it's the Real,
Yes.
The bus system. I know right now they're doing let's see, free student transport from rural areas to the colleges. But they haven't given me all of the details on that. They just gave us a call to let us know that that was going to be a new thing that they were providing.
When you say gas cards, what is the process to get gas cards to the parent?
So they would apply with us and let us know that's something that they would need, and we have gas cards on hand. We would just need to basically sign them out to that parent. And I don't know how many I have left. I have a handful left, so I'll be needing to order some more. Thank you for reminding me.
Make a little note.
I'm gonna
Awesome.
make a list note.
Okie dokie. Any other questions, guys? That was very informative. Thank you very much. Do you have an influx of applications coming in? I mean,
I have quite a few from Kingsville. However, some people didn't qualify. They're usually over income when that happens. So, I mean, if y'all have anybody in mind, give them my number and I'll talk to them and maybe we can get something taken care of. I'd like a few more clients that want case management. We have a lot that we get for emergency services. I need just one-time payment for this, one-time payment for that. But I'd really like some clients that need some case management that I can help the long run and get them to a point where they don't really need us anymore. That's my goal.
Wow, that's awesome. Great, thank you. Okay, so no more questions for Marina. Stephanie, will you tell us a little bit about your program?
Hello guys, I'm Stephanie Galindo. Most of you may know me because I used to work for CPS for a long time. Okay, I'm over the Housing Stability Program for Community Action. This program is serving homeless families or individuals. We're helping also families that are at risk of being homeless or unstable. There is an application process to qualify for our services. They have to have been financially impacted by COVID and they have to be homeless or at risk of being homeless. So they have to meet both of those as well as have an area median income of 80% or below. For our program, we do assist with hotel stays, rental deposits, utility reconnection fees. We were doing transportation vouchers, but mainly that's like for employment purposes because we're trying to get people stable to where they have some type of employment and they can pay for their rent. Also, we are currently out of it right now, but we have for personal hygiene products, childcare assistance for about a month to help parents while they're searching for employment. Our program also does clothing assistance, food assistance. Like I told you a second ago, we have the McDonald's and Whataburger gift cards. We can do grocery shopping as well if they don't receive SNAP benefits. And we also help with ID recovery. Like if they need a replacement driver's license, we can pay for that as well. Right now, we're already at the end of this fiscal year. So right now, all I have funds for is helping with rental deposits and utility deposits. But starting September 1st, we'll have funding for all the programs, or for assistance for everything that I just mentioned a second ago.
What is the criteria for being impacted by COVID? How do they meet that criteria?
Well, really, they have to self-declare that they've been affected by COVID financially. They fell behind on their bills because they were out sick from COVID, had no income. If they lost their job because work was slow because of COVID. I'm trying to think. There's been a lot of different stuff. I mean, some families have had a lot of domestic issues because of COVID, the financial stressors. And we've helped a lot of, in the beginning of this program, a lot of ladies that were trying to get away from that relationship because it had gotten violent due to the stressors of COVID. We've helped with that as well for them to get like the deposits when they've qualified for housing. So it made it easier for them. So really, I mean, it's just them putting it on a form telling us how they were impacted by COVID. If they have eviction notices because they couldn't pay, of course, I'll need like a proof of that. But for the most part, it's all self-declaration. They just write it out and we go off of what they say on the application.
Okay. And what did you say the income cap was for that?
Our program is different. Ours goes off of the area median income. So it's 80%. So more people qualify for our program than like for Marina's program because it's a little different.
On the child care assistance, how does that work? What is the criteria? So they would fill out the application?
Yes, it's the same. They have to be financially impacted by COVID, and they have to be homeless or at risk of being homeless. The thing that I'm running across here is I've tried to help people that are looking for jobs with child care assistance. However, all of the daycares here are pretty much full and not accepting. And it's been for like months that it's been like that. So honestly, I haven't helped anybody with that because of that. A lot of the daycares are full, but they have to meet the criteria. Like I said, the being homeless, affected by COVID, and the 80% below the, or 80% or below the area median income. But for our program, one of the things that I wanted to mention is usually they automatically qualify if they've been affected by COVID and they receive SNAP benefits. Or SSI. I've helped several family members that receive SSI also. So they usually automatically qualify as long as they have been affected by COVID. Like the income kind of, that 80% kind of goes away whenever they have those services already.
Shauna, did you have a question?
Yes, Stephanie, because the daycares are full, would y'all pay for them, for a person to watch their children? You know, like you get the neighbor down the street or the grandma or somebody.
Unfortunately, no, because whenever we pay for these services, we have to get those individuals to sign W-9s for us, whether it was a daycare or a landlord, even through housing, because I cover Jim Hogg County, they've had to send me their W-9s for their county over there. So it's really, I mean, if they're individuals and they're like a licensed home daycare and they have like the tax number or they enter their social, like we can help with that, but we need some type of invoice as well, because that's all that stuff that I need to submit for approval.
I have another question here. It says that you mentioned that you're out of hygiene products. Do you accept donations for that, or?
Well, actually, no, we don't take donations. It's that our stuff is funded through them. So I literally go shopping every time I have a client that needs it. I'll go to Alice to go to the Walmart over there and shop for them. I know there might be other programs that will accept donations. I know sometimes the Head Start program accepts them, like for families, because they'll go directly to them. So Head Start may accept those type of donations.
Thank you.
Mm-hmm.
And what's your service area, Stephanie?
I cover Clayburgh County, Brooks County, Kennedy County, and Jim Hogg County.
Any other questions? And what is do you have a lot of clientele? Are you seeing an influx of applications?
Well, I did have a lot of clients, but ever since, I'm trying to think, the beginning of May, I kind of ran out of hotel funding, and that's kind of when it stopped. Like the word gets around pretty quick. You'd be surprised, and people just stop coming in. But I mean, I still do have funding for, like I said, the rental deposits and utility deposits, but not for hotel stays right now.
Wow. Okie dokie. Any other questions, guys? Well, thank you. Was Melinda
here?
Yeah.
Yeah, she's here. I'll move back so she can come.
Perfect.
Okay. Sorry, guys. We still have to wear masks here, like
No,
whenever we're around other people. She's coming.
Good afternoon, everyone. How are y'all doing?
Hi, Melinda. How are you?
I'm doing fine. For those who don't know me, I'm Melinda Morales. I work with Community Action Corporation of South Texas with the Health Center Division. I am the Community Relations Specialist. So I'm going to talk a little bit about our health center. Is that okay, Nicole?
Absolutely.
Thank you so much for that. We do have 7 health centers And Alice, Valfurias, Kingsville, Benavides, Sinton, Beeville, and Mathis. We also do have a sliding fee scale for people who don't have insurance. If they qualify, we have different amounts, as a copay, but it's also helps them out because for labs, they get them at a fraction of a price. So that's where they get help. We also have the only place that we do have a pharmacy is in Alice. So if they're willing to drive, they can go and get their prescriptions also at a low cost price.
Is there an income cap to be able to visit a clinic?
Not necessarily. I cannot answer that question because it all depends on what they're bringing us to get qualified.
The clinic in Kingsville, is that over there by it's the one right there next to the Mother Teresa kitchen, or no?
No, ma'am.
Where
Our
are you
health
located?
center, so our health center used to be at 415 South 6th Street. It's been about 5 years ago. We moved to the hospital area. We're at the medical plaza towards the back area. We are at on the 3rd floor. We have pediatrics, family and women's health and behavioral services upstairs. And then on Suite C, excuse me, we do have dental services. That's downstairs.
That is amazing.
Thank you.
How did I not know that?
Don't be surprised. A lot of people don't know that. Like they still go to our old building. I mean, we did do a big old grand opening kind of deal, but people tend to forget, I guess.
How can we help you spread the word? That's awesome. And so do they call to make an appointment if they need services?
They can call to make an appointment. A lot of times if there is an opening, we do accept walk-ins. I know with Dr. Orion and Dr. Andaya, which are pediatric doctors, they do accept walk-ins. And then we also have Ms. Laura Requeñez. She is also works pediatrics.
And where is your location in Alice?
In Alice, it's on, you got me here, 700 Flournoy Drive.
Okay.
So it's the old Spawn Hospital building.
I know exactly what you're talking about.
Yes, ma'am.
All right. That's amazing. And so what other services they provide? You said pediatric, obviously adult health care, and then
we have behavioral services for all ages, and we have women's health.
Okay, great.
And of course, here in Kingsville, we have dental services. A lot of people know Dr. Joe Mendez. That is our our dentist here in Kingsville.
That's so wonderful. Anyone have questions for Melinda? Let's see. Oh, I have a question really quick. I missed one here for Stephanie. It just asked, when do you see hotel assistants coming back? I think she said in September.
September 1st, we'll have funding back for all the other programs. But I know in the past, you may hear we paid for a month at a time for individuals, but starting September 1st, the max that we're gonna pay for is 2 weeks for a client or family.
That's still a lot. That's awesome.
Yes.
And then,
I'm just gonna, oh, sorry.
go ahead,
I was
please.
just gonna cut in. My funding ends in December and it does take us a while next year to get funding. So like this year, our funds were supposed to be coming through January and we got them, I think, mid-March. So it does take a while for us, but we do have it until December and I still have plenty of funding.
And then Melinda, before you leave, it says if a person is unemployed and has no income, will the person qualify for health services?
They actually do need an income.
Okay.
Anything, I mean, like if they do side work, or something like that, as long as they bring a paper with a phone number and the name of that person, we're able to help them.
Awesome.
Okay.
And then I have one that says, do you guys have phone numbers? And then hello in advance. Thanks for the presentation. Very informative.
Oh, thank you.
Our phone numbers are on the flyers that Marina had emailed to you on
I
Friday.
sent them out.
Okay, yeah,
And then I can.
and our
share them.
emails. And I had asked Marina to send the one that has everybody's information.
Okay.
The generic flyer. I'm gonna post Melinda's because her phone number wasn't on the flyer. What's yours?
361
Okay,
221 8922.
8922. It's Melinda.
You're more
Okay.
than welcome to call me with anything that you need.
It has a lot of information. She's been with Community Action. Melinda's been with Community Action for a long time. And she does a lot of the outreach, well, most of the outreach for us, not just for the health center, like for all of us. So
For everybody. That's where I know her through the healthcare circuit.
yes.
Awesome,
Yeah.
awesome. Okay, I see Melinda's contact info here in the chat. Does anyone else have any questions? Well, I thank you guys very much for taking the time to come and talk to us. I really see these services are very valuable, and I just picture our parents that could utilize the services that probably don't even realize that this is available to them. So I thank you guys very much for the opportunity to come and present to us. We appreciate that.
Yes, and thank you for having us.
Yes,
We're
and
Thank you.
excited to talk about our stuff.
Yes,
All our
and
programs, all the good
we will
stuff.
definitely spread the word, and I will be seeing you at your upcoming events. Because I will
All
be there.
right, sounds good.
Okay,
There you
see y'all
Thank you
later.
very much.
Have a
Thank you.
good week.
Thank you.
It's very helpful.
You're welcome. Bye.
Bye.